अथ क्षीणबलीयं वाजीकरणचिकित्सं व्याख्यास्यामः यथोवाच भगवद्गन्धर्वैः. Vajikarana is a special branch where the sexual capacity and sexuality is enhanced. Now, there are a lot of sensitive issues in this issue, like what the Indian philosophy would be looking at the sexual behavior. That's a very interesting issue. The Indian philosophy has a very wider view of the sexual behavior. The sexual activity is compared to the or may be considered as an essential feature for the procreation. It starts from the Srishti, Purusha and Prakriti Sanyoga. Result is a representative of the creative activity where the male and the female components, they are Purusha and Prakriti are representing that male and the female components as such, which also has a very wider philosophical issue of energy and the matter as such, and the combination is considered to be the procreation, starting of the procreation. Then it comes to the ground level where the different activities of the sexual activity are detailed in a very elaborate manner, and you have a separate branch of maybe a study like Kama Shastra written by Vatsayana. So the total perception of about the sex and sexual activity in Indian philosophy is very extensive, and it's almost covering every aspect of the life passage. The whole life of a human body is considered to be at three stages, like the brahmacharya, then the grahasthashrama, the four ashramas, vanaprastha and sannyasa. Grahasthashrama is that stage where the person is supposed to have a union with the other sex, and it results in the procreation, and that procreation is considered as a pitrurana. That's pitrurana is something like a debt given by your ancestors, and it has to be repaying that debt by procreating. So this is how the whole activity is considered in a very elaborate manner, and it's not simply a game play, or it's not simply a freedom activity. Of course, karma word means karma is the word representing the sex act, and the meaning of it is desire, extreme desire, and it's considered also as a physiological need. So that perception of sexual activity from Indian philosophy point of view is very elaborate, and it has a very wider perception, and it's not possible to cover that whole area in a brief manner. But from Ayurvedic point of view, from the medical point of view, the issue is about facilitating the sexual activity and making a person capable of procreation. So we limit to only to that issue. Now from that point of view, vajikarana is a special branch which enhances the sexual ability and modifies the sexuality of a person. Now the vajikarana, according to Sushruta, is kalyasya udagra vayasah vajikarana sevinah सर्वेषु ऋतुषु अहरहः व्यवायुः न निवारितः स्थविराणां निरंशूनां स्त्रीणां वालभ्यमिच्छतां योषिप्रसङ्गात् क्षीणानां क्लीबानां अल्परेसहं विलासिनाम् अर्थवतां रूपयौवनशालिनां ऋणाञ्च बहुभार्याणां योगाः वाजीकराः हिताः. Now, Kalyasya is who has a habit of having the shodhana regularly. Kalya is Shuddhadeha, where he doesn't have any other disease. Udagrabhayas, a proper age group people who are capable of the sexual activity, which we also call as sexually active phase of the life, they are supposed to take the vajikarana. And they are those who have to who do practice sexual activity daily, every day, like, and throughout the season, who want to have that, or in extreme old age, or the persons who have maybe a relationship with many people, like Srinam Alabhyam, which is in the sense to have satisfying the other sex. Then those who are become weaker, and then those who are having a sexual deformity, sexual dysfunctions, or those who have a relative less virility, and those who are otherwise seeking pleasure as such, who are rich and who have that body, perfect, attractive body, kings, and those who have many wives as such. Now, this is about the indications for the vajikarana chikitsa. The another controversial issue is whether the vajikarana is only for the males, why not for the females? Whether it is totally a masculine activity or feminine also is there. Now, this controversy is, of course, absolutely true. And from Ayurvedic point of view, from the textual description, major issue of the vajikarana is related to the male sexual activity. The female sexual activity and the female sexuality is almost not presented properly in Ayurvedic text. Now, from the current point of view, the WHO, no, because in the current society also, sexual and sexual activity has become a big issue, and it's a reason for a lot of social chaos as such. Perceptions about the sexual activity in different society is different, and as the time changes, the perception also is changes from generation to generation. So there's a lot of sensitive issues. From that point of view, the WHO has taken some specific steps to define this, and the first step, or rather a major step in that, defining sexual and sexual activity from the health character point of view, from the medicinal person's point of view, perception of the medicine. Now, I am not dealing with the other points. The issue related to the sexual activity from the medical world point of view, medical perception point of view, WHO has started an activity to define these words related to the sexual activity and have the terminology and the program options. Like in this was done in from 2000 to 2002. For 2 years, there was a lot of activity in the WHO with the Pan American Health Organization, and this was dealing with the sexual health related terms to be developed, that the definitions. Now, from that point of view, now I leave apart all the other social issues and the emotional issues, entertainment issues. Those are other issues which will not bother. We will bother only from the health related point of view. The definition would be sex according to the WHO definition, latest, the current definition is, refers to a biological characteristic that define humans as female or male. So that character which defines the male and female identity is defined as sex. And while these sets of biological characteristics are not mutually exclusive, as there are individuals who possess both, they tend to differentiate humans as males and females. Now, there could be some exceptions about the sexuality or the sexual characters. From the psychology point of view, the persons with that behaviors, sexuality behaviors, they are now categorized into many categories, and for the sake of convenience, from the psychology point of view, defining the human characters, social characters, there are a lot of overlapping characters. Many people may have a male physiological structure, but may have a female sort of these emotions, or otherwise vice versa, that cross-sexual issues. So from that point of view, the personalities are defined as a male, where all male characters, physiological characters as well as psychological or emotional characters are typically male, android. Whereas there are another category which is female, where again you have all the characters as such. Then there is some area where patient may have a male physiology but a gynephilic feeling, that emotions, and that's called as heterosexual. And a person may have a few of the male characters and physiological, and a few of the female physiological characters, as well as some psychological characters. They are called as ambiphilic or bisexual. And those who have more male characters, and they tend to prefer to have a union with the male only, they are called as homosexual, and it's called as androphilic characters in such conditions. And bisexual with the intersex. Some people may have a bisexual characters, but they still have a affinity for the other sex as such, that's intersex, that's called as bisexual. So these words bisexual, homosexual and heterosexual words are defined based upon the physiological characters and the psychological issues of the person, and there is a lot of overlapping, and hence definition of a male and female from the technical point of view becomes difficult. But for all practical purposes, if you draw a midline over these characters, the issues on the or the characters on the right side are considered as male, and the left side is considered as a female. This is how psychologically the characters are identified. But still, we do use words like homosexual, bisexual, and so on. Now, sexuality is another term which is defined by the WHO, and definition is, as I have just copied exactly as it is mentioned by the WHO definition, a central aspect of being human throughout life encompasses sex, gender identities, roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. So, it's not only the physiological characters. It involves how the person behaves, his social activity, his orientation, the thought process, how he is erotic, like which makes him like erotic, or him or other, and how he seeks the pleasure, and how the relationships develop. These are all the factors which are considered as sexuality. And sexuality is experienced and expressed in thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. So, sexuality is not defined only by the physical characters. So, physical characters of the sex is to define like a person who is male or female, but a person may have a sexuality which is varying from that physiological deformity, which has to be assessed by the expression of thoughts, fantasies, desires, etc. So that issue is you need to consider the whole personality of a person to decide the sexuality of a person. Then while sexuality can include all of these dimensions, not all of them are always experienced or expressed. Sexuality is influenced by the interaction of biological, psychological, social, economical, political, cultural, legal, historical, religious, and spiritual factors. So, whether the sexuality, that emotions, fantasies are expressed or not, many times they are not expressed or experienced, and they would be affected by the social, your environmental factors. It could be psychological, social, economic, and so on. So, the issue is very complex to decide about the sexuality. Then there is another word called sexual health, again defined by the WHO. Now these are all issues which we need to be aware of from medical personal point of view, medical field point of view. We need to be aware of these words, and that's why I have just referred to these issues. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. So when a person has some emotions and so on, all that behavioral issues, and patient is in consonance, the person is in consonance with that kind of a feeling and is comfortable, has a physical, emotional, and mental well-being, even with that emotional issues as well as the physiological structures, that's considered as a sexual health. And it's not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having a pleasurable and safe sexual experiences free of caution, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. Now, this is about the sexual health, and all these definitions are common for both male and female. It's not about only for male or female, and these facts have to be considered in the present situation. And when we consider the sexuality in the present day situation, the issue has to be considered in all the aspects, and this is how it is considered from psychology point of view. Whenever a patient has to be considered for the sexual health and sexuality asset, we need to consider the body, the physiological structures, thoughts and feelings, the expressed gender, relationships, the values and benefits in that particular society and particular community. So all these factors have to be considered, then only we can say whether a person has a sexual health or not. But in general, the major issue is about the body process and the relationship. This is how the people consider the sexuality, but the other aspects are generally not considered as such, which is not correct. But whenever a sexuality or sexual health of a person is assessed from the health point of view, medicinal point of view, we need to consider all these issues. Now, WHO has given a policy statement. Now, this is common for every nation and every sort of human being. And at present, many of the policy makers or many of the policies are decided throughout the world based upon these policy statements. And that's it. Sexual health is about well-being, not merely the absence of the disease. Sexual health involves respect, safety, and freedom from discrimination and violence. Sexual health depends on the fulfillment of certain human rights. Sexual health is relevant throughout the individual's lifespan, not only to those in the productive years but also both the young and elderly. Sexual health is expressed through diverse sexualities and forms of sexual expression. Sexual health is critically influenced by gender norms, roles, expectations, and power dynamics, etc. Now, these issues are quite significant from the changing perceptions in the society. You have a lot of confusion issues, and many of the issues like as an example, I would like recently Supreme Court in India is seized up an issue of reducing the age of consent for sex, and they have taken the opinion of the government, and probably the issue was in the newspaper for 2 or 3 days back, like, and those who are aware of this, now all these issues are coming up and lot of confusions are there, and ultimately the decision would be taken based upon the basis of the WHO policy statement, and from that point of view this policy statement is important. I will not go beyond that. Now, coming to directly the health related issues, the sexual response or sexual activity, that physical sexual activity, limiting to that sexual activity as such, when a patient comes to you with impaired sexual activity or what we call as a sexual dysfunction, the dysfunction could be felt by a person either at any of these stages of the sexual response, and these stages of the sexual response are categorized as excitation phase, where the person would have a physiological changes in the heart rate, blood pressure, and respirations. Now, these are common for male and female. It's not only for male. Generally, what happens is when we read many of the other texts, it looks like it's related to the male only, but it is not so. And then there is a plateau, there is a surge of sexual tension in the person, emotional, and then there is an orgasm. Orgasm is a release of endorphin, and with ejaculation in a human being, this male, and resolution. At the end, there is a cool down period. Now, all these 4 stages would give you a sense of satisfaction, and the person would be feeling a sexual health. If any of these planes are affected, stages are affected, the person may have a sexual dysfunction, and the patient may seek for medical advice. And from that point of view, it is important. And a person would be seeking for a sexual consultation or counseling when any of these are abnormal. That's exactly what's mentioned in Sushruta. Sevamano eda autityad vajivat artha bhagavan nari tarpaite tena vajikaranam chede. The vajikarana is defined by activity which is compared to the sexual activity of a horse. The horse sexual activity is considered to be prolonged. The duration is supposed to be prolonged as such, and because of that comparison, it's that branch of science which relates to the sexual activity. That word aphrodisiac, which is used in the current terminology, is not satisfactory or is not complete about when it comes to the question of vajikarana. Aphrodisiac is only which enhances the sexual penile erection, and that only that much, not the whole issue. Whereas vajikarana relates to all the 4 stages, as such, and it gives a complete perception of the sexual health as such. Now, those factors which are considered which can stimulate the sexual activity would be kai bhojanani vichitrani panani vidhani cha vachah shrotra anugaminiah tvachah sparshasukastata yamini sendutulaka kamini navayavana गीतं श्रोत्र मनोहारी ताम्बूलं मदिरास्रजः गन्धाः मनोज्ञाः रूपाणि विचित्राणि उपवनानि च मनसश्च अप्रतिघातः बाजीकुर्वन्ति मानवम्. The factors which can give you enhanced sexual ability and a better sexual health are related to the food, one, and the surroundings, the stimuli given from other senses like the sounds like vacha, speech, the way you communicate, sparshasuka, touch sensation, and the appearance of the partner. Now, in this case, it's mentioned only about the female partner, but it could be the other way also, both the ways. Then in the surroundings like Geetam Shrotra Manohari, like it could be like music or so on the factors, Tambula, then Madira, alcoholic inebriating substances. Now this is about a controversial issue, whether alcohol really enhances the sexual performance or not. It's a controversial issue. Ultimately, it's not really enhancing the sexual this performance. Rather, it gives a false feeling of a enhanced sexual performance. So that's the other way. We will not go into that part. Then Srajaha Gandaha Manojaha, the physical appearance, like all the decorations or what we call the cosmetics which are applied over the body, and the surroundings like like whether it is in a like garden or so on, such surroundings which produce that sexual activity. And the most important is Manasashta Apratikataha, having a psychological balance or balanced mind is one of the important issues. When it comes to the question of sexual disorders, from the medical consultation point of view, in the current practice guidelines, clinical practice guidelines, based on ICD-10 classification, sexual abnormalities or sexual disorders are categorized mainly into the desired disorders, where the person will have abnormality related to the desire. And these can be like lack of sexual desire, sexual aversion, excess of sexual desire, or failure of genital response, according to ICD-10, the present classification. Earlier DSM classification, of course, there was categorized into in the male in erectile disorder and in the female orgasm disorder as such. Then there is another issue is of course in the desire issues, male hypoactive sexual desire and female sexual interest or arousal disorder. This is how it is categorized in DSM-5, but for the present it is about the ICD-10 as such. Then arousal disorders like orgasm disorders, where there could be orgasm dysfunction or lack of sexual enjoyment, premature ejaculation in male. Pain disorders, non-organic dyspareunia or vaginisms like dyspareunia, pain felt during the activity. Then there is another other sexual disorders like paraphilias, gender identity disorders like paraphilias are having a sexual desire with the other species, right? And gender identity disorders like male having a sexual activity with the male or so otherwise homosexual activity, or other dysfunction not caused by organic disorders as disease specified sexual dysfunction. This is how it's classified. ICD-10 classifies the sexual disorders into these categories. Now, this is considered to be the standard issues. Now, comparing that to what Sushruta has said, from Sushruta's point of view, the categorization of the sexual disorders are Kaistri Bhavehi Ahirdestu Riramsoho Manasikshate Dveshastri Samprayogatya Klaibyam Tatmanasam Sram. One of the Klaibya or the sexual disorder is a manasa, psychiatric issues, where there is a psychological issues. Now, compared to what the current science would say, it's exactly where Sushruta has said one category of the people who have sexual dysfunction could be due to psychological issue, and the causes could be, there could be ahridya bhavas, something which is not like the person, and or the person who has a very strong emotion in the mind, manasik shate, or dvesha state sampraya, he doesn't like the partner. Then the other is related to the physical conditions and the food as such, or nourishment. Katuka amla ushna lavani achimatropasevithi somyathat kshevo drishtaha klaibyam tadaparam smram. Another type of the klaibya is due to the consumption of improper food or improper nourishment. So, it's a physiological issue. Now, when you deal with a person with the sexual disorders, these factors have to be considered in which of the person, which component has to be taken with. That's how it is assessed. So assessment is very classical and very scientific based upon mentioned in Ayurvedic text as such. Then Atipeya Shiloyo no Vajikriya Nacha Vajikriya Dosabangam Apnoti Kachukrakshay Hedukam. Another is Shukrakshaya Kruta. Shukrakshaya can be produced due to excess of sexual activity. Now, as we have discussed in the previous classification, abnormal sexual behavior where the person would be having more excess activity. There could be erection disorder and erectile dysfunction, which is very popular word now, ED. People would use the abbreviation like ED, and that the Dvajabhanga is, it could be due to the abnormal sexual behavior. One, or the another is Mahata Metrologera Marmachedena Vapana Kaipem Meta Chaturtam Syatanram Musta Ubaghatajam. The fourth is due to either diseases or due to injury to the person. So Marmacheda or diseases which could produce that. Then there is another category is Janma Prabhati Yaklibaha Kaipem the Sahajam Sutam. Balina Sahaja is congenital, where there is a abnormality of the structures since its production, like which we call as the chromosomal abnormalities, like trigamy and so on. So abnormality, chromosomal abnormalities resulting in a sexual dysfunction. Then Badinah Shuktamana Saha Nirodha Brahmacharyataha Shastram Klaibhyam Matam Tattu Khara Shukra Nimittijam. One more of the klaibya or sexual dysfunction is abstinence, due to persistent abstinence. Those who are otherwise physically strong but mentally they have a desire but it's suppressed continuously, that can result in a klaibya, and it's according to Sushruta, the shukra, the semen would become affected, quality of the semen would be affected due to a persistent abstinence, and that's called as khara shukra. Then among the treatment protocols, asadhyam sahajam, sahaja, congenital is asadhya, it's not curable. Marmachedate, where there is an organic injury to the genital organs, that also cannot be treated. Whereas in others, sadhyanam vitareshantu karyo hetu viparya. In others, whenever you deal with, you have to consider the causes, and the treatment has to be based upon the cause. Like if a patient has psychological abnormality, that psychological abnormality has to be corrected. If a patient has a physical abnormality like dhatukshaya, that has to be supported. If a patient has a behavioral abnormality, that behavioral abnormality needs counseling, and so on. So the approach would be based upon that. Now, from the current point of view, the basic issue is majority of the patients who present with the sexual dysfunctions, they have psychogenic conditions, whereas some of them are organic. So for the current clinical point of view, whenever we assess or define like whether it's organic or psychogenic, the simple clues, now whatever I have suggested is here simple clues, not that they are absolute. You need to have more elaborate physiological examination and confirm whether it is a organic pathology or a psychogenic pathology. But the basic issue is usually predominant organic pathologies are seen in older people, whereas psychogenic conditions are seen in younger people. Gradual onset is generally seen in case of older people, except in trauma or surgery, whereas sudden onset of that sexual dysfunction in a younger age patient would be of psychological origin. Then circumstances, like whether the person has a sexual dysfunction throughout, irrespective of the factors like who is the partner and so on. Whereas in case of psychological issues, situational. Only at certain situations he may have the incompetence, and in some other situations it could be. When the symptoms are consistent and progressive, that could be due to the organic pathology. If it is intermittent, like at some times of the month or some times of the day or so on, it happens, then it is usually psychogenic. If a person has a normal desire to start with, but he is not able to contain or sustain the sexual activity, it could be due to organic pathology. When the desire itself is decreased, it could be psychogenic pathology. Then organic risks like injury or total structural abnormalities, they may be present in organic pathology, are not seen as such. The partner problems are anxiety and fear problems, psychological issues, may not be a primary issue in case of organic pathology, whereas they are seen in the beginning in a psychogenic condition. So whenever a patient presents with a sexual dysfunction, it's how it can be categorized as psychogenic or organic to a great extent. Organic conditions, they are now in the present day situation, the medical treatment involves lots of drugs, like I will not go into all that detail. The therapy of the organic pathologies are mainly either with the drugs, and among them the very popular drug sildenafil or Viagra, which has become quite popular and misused also, lots of misused drugs. And then you have plenty of other psychoactive drugs like apomorphine, phenylethamine, or hormonal drugs like androgens. Then there are certain drugs which can enhance the penile erection, stimulate penile erection, vasoactive, which can be directly injected into the penis, that phentolamine like drugs, preparing, these also are misused. Then there is intraurethral therapy, drugs which could be directly introduced into the urethra to enhance the sexual performance. Again, that again is about the male component only, enhance the erection only. Then the injections of the other hormones like testosterone, nitroglycerin, etc. Then a physical vacuum constriction devices which can enhance the size of the penis, or penile prosthesis and reconstructive surgeries. These are all in brief about what is considered the total protocol of the treatment of sexual dysfunction from medical or interventional point of view. But majority of the other person would be the psychological consultation, counseling. Counseling is the major part of the sexual act. This is how the whole gamut of the sexual medicine in the sexual activity in the current situation. Now compare this to what Sushruta or Ayurvedic could suggest about the vajikara chikitsa. Now from Sushruda's point of view, vidhi vajikaro estu tam pravakshyami yata param. That vajikara vidhi are mentioned, which again involves certain medicines, certain of the factors which are related to the surrounding areas and so on. And among them, the most important are the medicines, drugs. Instead of the specific molecules and hormones, Sushruta has suggested about certain simple drugs which could be used as a stimulation for the sexual activity, enhance the sexual performance and improving the sexual health. Now we have to consider all these issues. It's not only about enhancing the sexual performance. Now tila masha vidarinam shalinam churnamevacha paundraka ikshurasaihi artra marditam saindhavarmitam varahametasayuktam gristena utkaritam pachet tam bhakshayitva purusa gacchetu pramarachatam. A utkarika, a puri like food preparation prepared with tila masha, vidari, etc. and with the varaha medas, the fat of pigs that is used for frying that utkarika, and that's considered to be one which enhances the sexual activity as such. Now, the word like pramadashakam, 100 women and so on, this need not be taken by actual word meaning, literary meaning. It has been considered just as a LEP for enhancing the sexual capacity, sexual ability. Similarly, Basta Andasiddhe Payasi, Bhavitan Asakritilana, Shishumara Vasapakwaha, Shashkulyaha, Tilehi Krataha, Yakhade Sakuman Gachet, Strinam, Shatam Apurvat, another Chakuli, Shashkuli prepared with the Bastanda, the eggs of birds, and with the Tila and Vasa as animals. Now important is Tila, Vasa, these are mentioned very frequently, and Kshira, milk and Grata. These are mentioned very frequently in all the majority of the yogas related to the enhancing the sexuality. Another one, similarly, Pipari Lavanopete, Basta and Kshira Sarpishi, Savite Bakshay Desto, Sagachet Brahmalasharam, Basta and eggs with that preparation. Pipari Mashashalinam Neva Godumayostata, Chuna Bhagi Samay Taisto, Grute Pupalikam Pateta, Tam Bhakshaipa Pipato, Sharkara Madhuram Payaha, Naraha, Chatakavadgachet, Dashavaran Nirantaram. This is enhancing the statue phase of the sexual activity, where the time taken for the ejaculation is enhanced. And there, the yogas mentioned there, Pipari Mashashali with the prepared in the grita and presented as a Pupalika. Then Bidaryaha Sukritam Churnam Swarasayaniva Bhagatam Sarpir Mathitam Liva Dashastrihi Adhikachati. एवम् आमलकं चूर्णं स्वरसेनैव भावितं शर्करा मधुसर्पेभिः युक्तं निर्भापय पिबेत् एतेन 80 वर्षोऽपि युवेव परिशिष्यति. Now, certain of the important is certain of the combinations are mentioned for the enhancing the sexual desire. Certain are for enhancing the statue phase, the duration of the erection as a sexual activity. Certain of the drugs are to enhance the sexual erection phase, erectile phase as such, and certain of them may be to improve the fertility. So this is how it has to be looked at, where the quality of the semen is enhanced. Now, Vidarya Supatam Churnam Saraseniva Bhavitam Sarpir Madhitam Liba Dashastri Adhigachati. The Vidari and the Churna prepared with the Sarpir Madhu. Then Evam Amalakam Churnam Saraseniva Bhavitam Sharkara Madhusarpe Yuktam Libha Paya Pibeta Yetena Ashiti Varshobi Yueva Parishani. For senile old persons, Amalaka Churna with the which is again processed with the Amalaka Swaras with the Sharkara and Madhu can be given. Then Pippali Lavanupete Bastande Satite Shim Araste Ba Khade Te tu Vajikare Bhrijam Kulira Kurma Nakra Anda Mandan Yevam to Bhaksheta Mahisha Rishabhastanam Pibet Shukrani Banaraha. The consumption of the eggs of different animals or birds, different birds, and or the basta, that's the bladder or testicles of the animals like Mahesha, Rishabha, etc. also are considered as the ones which can enhance the quality of the shukra, the semen. Ashwatha pala mulat pag shunga siddham payvanaraha pitva sashakara chaudram pulinga iva shishaji. Then another one which enhances the sexual enjoyment, like the desire component. Then Bidari mulakakam sudena payasa naraha udumbara samam pitva ruddho pitarunayate. Another drug which enhances the sexual ability in old persons, so senile changes can be neutralized. Mashanam palam ekam tu sanyuktam kshaudra sarpisha avaluksha payap pitva tena vaji bhaven naraha. The mashapara, these are given to enhance the time taken for the sexual activity, the duration of the sexual activity. Shirapakvam Suboduman Atma Gupta Palai Saha Shitan Grisaitan Khade Tada Paschat Payap Pibeta Nakra Mushika Manduka Chataka Andakazam Bhuzam Tada Bhengena Kurute Balam Bhumim Tanas Prasheta Yabat Sprishatino Bhumim Tabat Gachet Nirantaram. Now this is also is about the total vigor of the sexual activity, and it's considered like the person would not touch the earth, touch the soil as such, as such during the sexual activity, and very powerful sexual activity will be produced due to consumption of the Kshirapakva, Goduma, Atma Gupta, etc. Now that's all the important issue. When we say Vajikara Yoga, it's not that every yoga would have the same target. The targets are very specific. Then Swayam ta Ikshurakayoho Palachurnam Sasharkaram Tharosnena Ratpitva Payasa Nakshayam Rajeta, which will not result in the Shukraksha. If you consume the Swayam Gupta, that's Atma Gupta drug like, and with the Sharkara, with milk as such, it doesn't result in the relaxation of the semen. The quantity of the semen will be enhanced. Uchchata churnamapyevam kshirena uttamam mishade shatavadi uchchata churnam peyam evam balasthina swayam gupta phalayiriktam mashasupam pivennaraha gupta phalam gokshurakacha bijam tatha uchchatam gopayasa vipachya khajahatam sharkaraya yuktam pitva naro hrishyati sarvaratram. Again a combination which can enhance the duration of the sexual activity. Mashan Vidari Mapisauchatam Kshire Gavam Kshaudra Gzopapannam Pitva Narash Sharkaraya Suyuktam Kulingavat Hrishyati Sarvaratram. Another yoga which can enhance the sexual vigor as such. Gristinam Vruddhavatsanam Mashaparna Bhridam Gavan Yat Kshiram Tat Prashamsanti Balakamesh Jantusho Kshiramam Sagana Sarve Kakol Yadishta Pujita Vajikarana Hitohi Tasmat Tatpayodeheta. Milk of cows which have delivered for the first time, Bristi Kshira is the first delivery, or Vruddhavatsa, those cows which bear it has delivered quite a long time back, and at the end of that phase of lactation, those milk consumed there will be considered as a better for the sexual activity. Then Mashaparana also is added to that. Are those cows which eat on or which live on Mashaparana leaves as such, there also is considered as a better for enhancing the sexual potential, so physiological need of the sexual as such. Then ete vajikara yogaha priti apatya balapradaha sevyaha vishuddha upachitudehi kaladi apekshaya. These vajikara yogas should not be consumed at random or without any purpose. They are to be used with the specific target which can enhance the priti, that's the psychological satisfaction of the sexual activity, or apatya, it can enhance the productivity, or the fertility can be enhanced selectively. Balaprada, it can enhance the physical strength of the person, and all these have to be considered in a healthy person. Vishuddha upachita dehi, in a otherwise healthy person, and where the person doesn't have any other diseases. And you also have to consider the seasonal and other aspects, the time relationship. With this, vajikarana chikitsagam nama षड्विंशोऽध्यायः, one chapter completed. We will continue in the next place. If there are any questions, may I know which chapter and sthana. I think we are dealing with the chikitsa sthana, 26th chapter. I think that's very obvious there. So, okay, so that's about the vajikarana, right?